And to be somewhat controversial, I believe that a suitably trained human eye and mind are potentially better than a variety of objective means for assessment of multi-limb lameness. A commonly used lameness grading scale is that of the American Association of Equine Practitioners. And contrary to common usage, this is not an ordinal scale. Each grade has specific definitions. So grade 1 is difficult to observe and not consistently apparent regardless of the circumstances, such as weight carrying, circling, inclines, and hard surfaces. Grade 2 is defined as difficult to observe at a walk or trotting in a straight line, but is consistently apparent under certain circumstances, such as weight carrying, circling, inclines, hard surfaces. But what about the episodic lameness, the intermittent lameness? Grade 3, the definition is consistently observable at a trot under all circumstances. Grade 4, obvious lameness with marked head nodding, hitching the hindquarters, or shortened stride. Grade 5, characterized by minimal weight bearing in motion or at rest and the inability to move. Quite difficult to fulfill all those criteria, in my experience. I believe that the AAEP scale does not permit grading of lameness independently at walk and trot, or under different circumstances. For example, comparing a horse moving in straight lines and in circles. In my experience, lameness may be quite severe at a walk, but mild or inapparent at trot, or vice versa. I feel I need to describe these two circumstances independently. A horse may appear consistently lame in straight lines, but not in circles, and this cannot be classified under the AAEP scale. What about another reason for not using the AAEP scale? Let's consider this horse on the right. This horse on the right has a distal border fragment from the medial aspect of the navicular bone in association with a large radiolucent zone in the parent bone at the medial distal corner. And it also has evidence of proximal suspensory desmitis. The horse exhibited a grade 3 lameness. Remember the definition? Lameness is consistently observable at a trot under all circumstances. After blocking the foot, palmar-digital nerve blocks, the horse improved 50%, but still had lameness that was consistently observed at a trot. So using the AAEP scale, it remains grade 3. There was no change after palmar nerves performed at the base of the proximal sesamoid bones or after a low 4-point block, but palmar metacarpal subcarpal nerve blocks resolved the lameness completely. So, going back to the AAEP scale, how do I grade this significant improvement after blocking the foot? I can't. A horse may not show lameness in hand or on the lunge, but shows obvious right forelimb lameness when ridden, so has to be a grade 2. Desensitization of the foot did not make any difference to the lameness, but a low 4-point block resulted in 50% improvement. However, the horse is still consistently lame on the right forelimb when ridden, on the right rein, and therefore under the AAEP scale remains grade 2. So this is really not a very satisfactory means of demonstrating improvement. This horse was working very comfortably and then suddenly pulled up non-weight bearing lame. Such sporadic, severe lameness cannot be graded using the AAEP system.